everybody. This week in Nursing Theory, we're going to be concentrating on nursing philosophies. Our weekly outcomes for this week are to discuss the relevance of nursing philosophy to today's nursing practice. We're going to compare two differences in two of the nursing philosophies that are presented, and we're going to critically reflect and provide personal insight on how nursing philosophy is relevant to today's nursing practice. So let's get started. Now in this discussion, this hopefully will be a really short little video. It really just sets the stage for this week's learning. You'll have resources within your textbook and also online to help you really delve into the philosophies we're going to be reviewing. And of course, we'll be doing a discussion board and reply post so that we can hopefully learn from one another and that you can learn from your faculty. So, what is a nursing philosophy? In your textbook, and this is coming straight out of the textbook from Ollie Good, a direct quote that says, "Philosophies express the meaning of nursing and nursing phenomena through reasoning and logical presentation of ideas. They provide broad, general views of nursing that serve to clarify nursing values, to answer broad disciplinary questions." So, they are basically they're not as broad as meta-paradigms because meta-paradigms kind of can go into all aspects of nursing, but nursing philosophies really can be applied also to all nursing practice. They are broad ways of seeing nursing. They are broad ways of being. They are broad ways of practicing nursing. And so, again, applied to almost any area of nursing practice that you go into. They don't delve into just one specific place, but something that nurses should be doing in all of their practice areas. So I have a question for you all. Do you even have a individual nursing philosophy? And I believe back in your professional nursing course or in the beginning of the program when you started your professional practice courses, you may have discussed philosophy and you may have read about them and you may have been asked to come up with your own nursing philosophy based on the concepts you were learning at that time. So your own personal nursing philosophy should be the way in which you see nursing practice and the way in which you would like to practice as a nurse and how you see nursing as fundamentally different from other healthcare professions. So if you were doing your own individual philosophy, you would include probably the nursing meta-paradigm and even more. So you would want to talk about how you see the nature of nursing. You would want to know what is the meaning of being a nurse. You would want to explain that in your own personal philosophy. What does it mean to be a nurse? Because nursing is different. We are not care partners. We are not physicians. We are not, at this level, we are not nurse practitioners yet. For many of you all will go on to that, that level of nursing practice. Some will, some will not. So what in the place that you're living, in the place that you are in your nursing practice now, what is your philosophy and meaning of being a nurse? And the nice thing about philosophies is that you write them now and in the time and how you're living. And as you move through your career, you should always revisit a philosophy because it will be structured differently based on your experiences and how you see the world and how you view nursing as you evolve into your practice. The other thing you want to think about, or when you're reading nursing philosophies, is what ideas and concepts are central to the philosophy of nursing. So is it holism? Is it relationships? And we're going to talk about one of our philosophies this week is actually all about relationship. Is your philosophy about communication and the different ways of communicating with others? Is it about integrity? Is it about our whole value system? Is it about humans in action? Is that what nursing is? Are we humans in action? And depending on how you define action. So those are obviously very broad concepts that can be applied and be carried with you no matter where you go throughout your nursing careers. All right, so there's going to be three philosophies that we review this week, and in this course we are calling these three philosophies. When we get into the next one, we'll talk a little bit more about how some of them are seen as grand theories, but for our purposes, these are nursing philosophies. And of course, the first is Florence Nightingale, which I know you all have learned about and talked, read about Florence. And of course, her philosophy of nursing came about in a time before nursing theory was ever even discussed. She was one of the first, she was the pioneer in nursing who really defined nursing, who really said that nursing has a place at the table in and of itself. Nursing was not, they were not servants, we were not handmaidens to anybody, but we had our own body of knowledge, or should have our own body of knowledge, which drives our profession. And then we can work in concert with with other healthcare professions. So she saw nursing as different than other professions, and a profession that added value to the patient's life. She also viewed the environment as central to the concepts to her definition of nursing. So she really saw a relationship of patients to their environments, and it was the nurse's duty to provide an environment that promoted health. So in your textbook, there's a whole chapter on Florence Nightingale, and there are web links provided in the course content area. She has written, there's two documents that are interesting in the course content area. One is the notes on nursing, and that is Florence Nightingale's own written information of how she viewed nursing. It's a pretty hefty document. Please don't try to go in there and read the whole thing, because that would probably be too daunting. But you can kind of just peruse it and see what you think. The other document is an article written about the influence of Florence Nightingale, that Florence Nightingale continues to have on nursing practice today. All right, the next philosophy that somebody might want to view is Jean Watson. Now, Jean Watson has what you all know of as a theory of caring, but what she has really written is a philosophy of the science of caring. And so while it is applicable to nursing, it certainly can be used by many different people. And she really views nursing in relationship. She doesn't feel like you can really practice nursing outside of that relationship-based care. So it is within the relationship that nursing occurs. She has developed 10 curative factors that can be applied to all of nursing practice. And so when you look at the chapter in the textbook or the documents from the websites, you will see those 10 curative factors. Her philosophy is pretty abstract, and if you ever, Jean Watson still tours, and she still actually is a speaker at national conferences. She's still writing and still really influencing the practice of nursing today. Interestingly, a few years ago in this course, one of the students actually emailed Jean Watson, and she emailed her back. So that's kind of nice. It's always nice when the theorists and people that you're actually studying are still alive. She really does have a very abstract view in her philosophy, and she sees that caring factor going beyond just you and the patient relationship. She sees it as nursing caring for themselves, nursing caring for other nurses, nurses caring for other people who work in the healthcare system, caring for your environment. So all of those things are actually wrapped up in Jean Watson's philosophy. And the last one we're going to talk about this week is Patricia Benner, and I just think she is, all three of these philosophies or these theories are awesome. But Patricia Benner, who is still a speaker at many national conferences, I believe she is a professor emeritus still out in California, and she, if you Googled her, there are some videos online where she's speaking about nursing practice and how she sees nursing practice evolving. And yeah, they're just very interesting videos, and it's not part of this course, but if you're ever just sitting around on a Saturday evening and you want to watch something, Google Patricia Benner. Anyway, she did her philosophy really explains how the practice of nursing knowledge is acquired. Because we are a practice-based profession, and yet we have to have our research that drives us, you have to acquire that knowledge in some way. There is no way in nursing school you are going to learn the things you absolutely have to know to be a competent bedside nurse. You've got to get out and get your hands in it and practice for a while before you are. So how do nurses evolve into becoming experts? So she wrote a book called From Novice to Experts, and you go through these 5 stages that are up here, and it talks that all nurses start at a novice area where they come in with no professional experience, then they become a beginner, and then they move to competence, proficiency, and then they become an expert. And that's when they're using their intuitive judgment, critical thinking, that when a patient walks in the room or you walk into a patient's room, you look at them and your gut just knows. You just know there's something wrong. And then you start taking the steps to fix it without really having to go sit back and go, now what should I do next? So it's a great philosophy. We didn't post the book because actually it is a book from novice to expert. It is used in many practice or many healthcare systems, and they base their career ladders and nursing advancing through career ladders based on Bender's model. So Benner's model. So very, very interesting person. So if you choose to do her, I think you'll learn a lot. Okay, so for this week, I've just talked about the 3 philosophies we're going to delve into. No one expects you to read all 3 chapters. Again, guys, you get to choose. This is your course and your learning. And so while you have to learn about a philosophy, and you may choose that you didn't even want to learn about a philosophy, that choice actually is taken out of your hands. You do have to learn about them. But you get to choose which one, based on what you've just heard in this video, which one really sparks your interest. You know, is it going back historically and looking at Nightingale, who's a real pioneer in nursing? Is it looking at Watson and really trying to understand that caring relationship? Or is it Benner trying to figure out, how am I going to get to that place where I'm an expert nurse? Or which one of those 3 jazz you? And then you're going to go and peruse the chapter in the book, and also maybe look at the websites online. I know that sometimes reading these chapters, again, is very daunting. And so if you would rather just kind of peruse the chapters and really get some good data out of those websites that I posted online, that's certainly acceptable. And then for your discussion board, and remember, there will be a limit in how many students can do each philosophy. So look at your discussion boards and your syllabus and see what that limit is. You're going to answer the following question based on the philosophical framework that you chose to study for the discussion board. And you're going to describe how that either Watson, Nightingale, or Benner's philosophy is relevant to nursing practice today. And then in your reply post to your classmate, you're going to reply back to someone who explored a different philosophy than you did in your original post. So check your due dates for both the discussion board and the reply post to make sure that you're staying on track. And then don't forget to put that practice example in. I hate to see people lose points because you don't put in that nice